Hi, thank you for joining me today. Would you like to give a quick introduction just so we're aware of who you are?
Yeah, my name is Dr. Judy Correa Kaiser, and I am a psychology professor at Ambrose University.
Okay. So being a psychology professor at St. Ambrose University, what kind of extra stressors have you gone through since this whole COVID pandemic has began?
It has been quite stressful as a professor because St. Ambrose is characterized by small classes and in-person classes. Because of the pandemic, we have been forced out of the blue to be going online. And that took a lot of adjustment for me, for the students, learning equipment that I could not figure out and having to struggle in front of the students was difficult. So the modality of our teaching changed completely, and that person-to-person was not there.
So throughout the pandemic and transitioning back to in-person classes, did you notice an effect in your students in their academic performance?
Yes, it was difficult for students to have to know even when were they supposed to be online, what kind of assignments they were supposed to do. So it took a adaptation from students to be able to do their courses through online. We also teach hybrid, which means that sometimes part of the group goes in person, and then the other half is online, and then the next time the half that was online is going to be in person, and the one in person is online. And I have that sometimes students have a difficult time knowing when are they supposed to be in person or online, and then also they have a difficult time trying to figure out the equipment. Sometimes the how do you call it, the email or the program that they use is not working, so they missed part of the lecture. So I know that it has brought a lot of stress to my students, and stress usually relates to not doing as well as you would like to do.
It sounds difficult transitioning to this new format mid-semester. Can you explain how you managed to stay connected with your students and other peers, such as professors?
Yes, it was difficult, and it is difficult to continue to be connected with my students. We have to adapt to do WebEx, which is similar to Zoom, for office hours, for advising, so I don't have a chance to see the person in front of me. We have to rely on the camera. In terms of colleagues, it's difficult because we are all into looking at our computers, trying to communicate with students and being meetings through computers. So the social interactions that sometimes can be so helpful for support, and they're not there. So it has been an adaptation, and it can be stressful at times.
So it's normal for times like these to cause any added stress. Can you tell me if you've experienced any medical trauma, if you're comfortable with explaining that?
Well, it is traumatic enough to know that we are in a pandemic, to hear the news about how many people are suffering and losing jobs, and to see students struggle because they have to be moving home and not having the support. In addition, personally, my husband has some medical condition this last year, and just a couple of months ago, he had an incident that we have to go to the emergency room. And again, just going to a hospital when you're not supposed to be there with the person and you have to wear a mask, it has been pretty traumatic. So just the fact that we know how much is going on in the world, and that means that our students and all of us are experiencing trauma, and luckily there's some hope for the future, but we're still kind of trying to deal with how to live in this new way of living.
Thank you, Dr. Kaiser, for joining me. Goodbye.